Good evening. This is All India Radio, Kohima. I'm Jonas Yantan with the evening news. And the headlines. Centre approves setting up a 50-bedded district hospital at Noklak. National COVID-19 recovery rate reaches 96.66%. Defence Minister Rajnath Singh hails Navy's proactive forward deployment during standoff with Chinese troops. And Union Health Minister Dr. Vardhan says tobacco control needs to be pursued like mission and social movement. As the nation gears up for free COVID-19 vaccination campaign at government facilities for those above 18 years, we advise our listeners to get vaccinated. We also advise our listeners not to lower their guard as COVID-19 remains a threat to our health. Please stay at home unless it is essential to go out and continue to follow these 4 simple steps. Wear a face mask, maintain 6 feet for social distancing, focus on hand and face hygiene, and get vaccinated. For any COVID-related information and guidance, contact national helpline numbers 011-2397-8046 and 1075 and state helpline number 1800-345-0019. And now the news in detail. Centre has approved the setting up a 50-bedded district hospital at Noklak. Chief Minister Nipirio in a tweet expressed gratitude to the Union Health Minister Dr. Vardhan for approving the 50-bedded district hospital at Noklak, the newest district of Nagaland. Rio said this will greatly help the citizens of the district to access quality healthcare services. India is registering a significant decline in active caseloads and fresh cases of coronavirus. With this, the recovery rate is continuously improving in the country. The Health and Family Welfare Ministry has said the active caseload presently comprise 2.03% of the cumulative positive cases, and it is continuously declining. It said the country has registered a decline of over 14,000 active cases in the last 24 hours. At present, there are over 612,000 active cases in the country. The recovery rate has also reached 96.66% in the country. Over 2.91 crore patients have already recovered from this infectious disease so far. The country has registered a total of 51,667 new COVID cases in the last 24 hours. The Union Health Ministry said a total of 1,329 deaths have been reported in the country within 24 hours, taking the toll to over 3,93,000 across the country. In Nagaland, 130 new cases of COVID-19 have been detected today, along with 2 COVID-related deaths and 127 recovered cases. Of the new cases reported, 37 cases were reported from Mon, 31 in Dimapur, 20 in Perin, 13 in Mukukchung, 11 in Kohima, 6 each in Zonoputo and Woka, 2 in Peg, and 1 each from Kifere and Longling. While Mukukchung registered 78 recoveries, 31 from Dimapur, 7 in Mon, 4 each from Kohima and Longling, 2 in Zonoputo, and 1 from Peg. Of the total 24,759 positive cases, the total recovered has also reached 22,072, while 1,508 are active cases. Till date, 467 persons have lost their lives due to the infection. Sapotimi village under Suruhuto block in Zonoputo district has achieved 100% vaccination. In an information uploaded on Twitter handle of Health and Family Welfare Department Nagaland, it stated that 187 eligible beneficiaries comprising age group of 18 to 44 years and 45 years and above were inoculated. 94 beneficiaries were from the age group of 18 to 44 years, while 84 were 45 years and above. The department has congratulated the teamwork of Village Council Chairman, GPs, village elders and medical team for their relentless efforts. This news comes to you from All India Radio, Kohima. You can also listen to this news bulletin on our YouTube channel, AIR News Kohima. Defence Minister Rajnath Singh today hailed the Navy's proactive forward deployment during the standoff with the Chinese troops last year. He said that it signaled India's intent that it was ready for active hostilities with China. He was speaking at Kochi after reviewing the progress of work in the building of the indigenous aircraft carrier INS Vikrant, terming the IAC project and the Project Seabird that he reviewed yesterday in Karwar shining examples of Atmanirbhar Bharat. The Defence Minister said that the Modi government is committed to a strong navy. On his visit on board indigenous aircraft carrier, which is in advanced stages of construction by the Indian Navy, Singh said commissioning of indigenous aircraft carrier next year will be befitting tribute to 75 years of India's independence. The Defence Minister said combat reach of aircraft carrier will add formidable capabilities in defence of the country and help secure India's interest in maritime domain. Health and Family Welfare Minister Dr. Vardhan has said that tobacco control needs to be pursued like a mission and social movement. He said India's dedicated national tobacco control program and targeted actions taken by the government in the last 7 years has helped in tobacco control. Dr. Vardhan addressed a virtual event yesterday to highlight 25 years of global tobacco control progress. This event was part of the campaign for Tobacco-Free Kids' year-long 25th anniversary celebration. Addressing the event, the Union Minister said several measures were taken by the government for tobacco control. Dr. Vardhan said displaying large warnings covering 85% of area on packs of tobacco products, a dedicated helpline for assisting people to quit tobacco, combating the menace of e-cigarettes, and regulation of display and use of tobacco products in films and television programs are the major steps taken to generate awareness about the ill effects of tobacco. A national consultation on prevention of maternal, adolescent and childhood obesity was organized by Niti Aayog. It was organized in view of rising incidence of obesity in children and women over the past decades, especially the recent spurt shown in National Family Health Survey 5. In the consultation, global experts, representatives from UN bodies, central ministries and national research institutions presented evidence regarding increasing prevalence of obesity and best practices for obesity reduction. Niti Aayog has said that a consensus emerged on the need for a whole-of-government and a whole-of-society approach in tackling the twin nutrition challenge of obesity and undernutrition. It said that an urgent need for adopting strategies related to fiscal measures, regulating front-of baggage labeling, promoting healthy diet, physical activity, and lifestyle options emerged as key themes for future deliberations and actions. Union Education Minister Ramesh Pokhriyal Nishank today assured students that proper evaluation criteria will be followed in the Central Board of Secondary Education Class 12 examination. In a message posted on social media, addressing concern on the evaluation of CBSE board exams, Nishank said if any student has issue with the results, they can appear in the exam in August this year. He added that under the evaluation criteria, the students will get results as per their ability and talent. Nishank reiterated that health of the students and better future are the priority of the government. After nearly 4 weeks of rescue efforts by a combined team of the Indian Navy, SDRF, NDRF and Meghalaya Fire and Emergency Services, the third body of the 5 gold miners trapped inside the gold mines at Grem Ole of Umleng in East Jaintia Hills district of Meghalaya was retrieved today. It may be mentioned that the second body was retrieved yesterday. The rescue mission has been carried out ever since 5 miners got trapped in the Rat Hole mine on 30th of May. And now 20 News, here the main points again. Centre approves setting up a 50-bedded district hospital at Noklak. National COVID-19 recovery rate reaches 96.66%. Defence Minister Rajnath Singh hails Navy's proactive forward deployment during standoff with Chinese troops. And Union Health Minister Dr. Vardhan says tobacco control needs to be pursued like mission and social movement. That is all we have in this evening news bulletin. Good night.